Now, our next expert also has a passion for vaccine research and promotion. Dr. Cora Constantinescu is a pediatrician and infectious disease physician in Calgary. She leads the 19 to 0 healthcare worker education team and continues to be a vaccine advocate at the local and national levels. I'll now pass it on to her for her presentation, Building Confidence Through Conversations, Useful Tools to Address Hesitancy when Discussing the Vaccine.
Thank you so much for having me. I'm going to first and foremost, I know that we've done a land acknowledgement, but I live in Calgary, and I also want to acknowledge that I live on the territory of the Blackfoot Confederacy, and that's the Siksika, Kainai, and Piikani, the Tsuut'ina, the Nakota Nations, and also Calgary is home to the Métis Nation Region 3. So thank you for having me. I'm going to also, before we go into the actual full presentation, share with you my disclosures. So I have received honoraria in the past from a variety of pharmaceutical companies and a number of other organizations. The last one was in February of 2020. This was for continuing medical education talks. And I haven't received any honoraria for COVID-related work or COVID vaccine talks. I also have, I'm one of the co-leads for the Healthcare Workers Stream of 19 to 0, which is a coalition of medical experts and healthcare professionals coming together for behavior change around the COVID-19 pandemic and vaccination. And even though 19 to 0 has had support from pharmaceutical companies, I haven't received any personal remuneration for the work I've done for them. And you'll see a number of pictures. A lot of them are in conjunction with 19 to 0, and we've purchased the pictures. So I've done the appropriate steps to ensure that the use of this third-party material in my presentation falls under the Copyright Act. And I've also cited third-party material. Okay, so what a fantastic day this is for me to talk to you about it for a number of reasons. And I feel privileged and grateful that I get a chance to talk to you about the COVID-19 vaccine, around conversations around that, and hesitancy and acceptance around this vaccine. And there are a number of reasons why this is a kind of a super crucial day. So obviously a National Kids Vaccine Day is as good as it gets in terms of the work that we do. But interestingly, yesterday was also the 2-year anniversary of the first case of COVID identified in Canada. And I also show you that we are in the greatest hospitalization surge of the COVID-19 pandemic in children. So this is the day that we can prioritize children's health, and each and every one of us become vaccine champions to look after our kids. And I cannot possibly talk to you about vaccine acceptance and hesitancy without putting it into the perspective of this Omicron wave. So I'll spend the first few slides on that. And then we'll talk about the concept of hesitancy around the COVID-19 vaccine, and then also some of the drivers and how we can message this vaccine to obtain that support and that partnership that Arnaud covered so beautifully with parents, both at a public messaging level, but also in one-on-one interactions. This is my all-time favorite slide. I don't do any presentations without it. This is just to remind everybody that most Canadians are not hesitant. Most Canadians have rolled up their sleeve and gone for personal protection and our community protection. We are now at over 80% of people fully vaccinated, and that does include the eligible population is 5 and over. But here's where we're at for children. And this is data from Alberta. And I'm no epidemiologist, but I have some very good epidemiologist friends. And this is data put together by Dr. Jim Kellner. And this is from the data that's publicly available on the Alberta Health website, and some of the hospitalization data that he was able to get. So this is where we're at. Right in the last month, so the last 4 weeks of this pandemic, it's 5% of the total days of the pandemic. We have had 166 children under the age of 9 admitted to hospital with COVID-19. And these children represent 41% of all children in the age group ever admitted to the hospital for COVID-19 during this entire pandemic. So when we talk about the greatest surge, this is what we're talking about. We've seen over 40% of all of our hospitalizations in children, and children under 11 are the largest unvaccinated group. We have seen the largest surge in the last month of this pandemic. And nearly all who have been admitted were admitted for COVID. So this is not incidental finding, this is for COVID. And nearly all have been unvaccinated. Either they were ineligible or not vaccinated. And this very much supports data that's coming out of the US, which shows that over 99% of their kids in hospital are unvaccinated. And I suspect that we're going to see a very similar data in our Canadian hospitals when we look nationally. This is where the vaccine effort has been in Alberta. And I think we can replicate this curve. Unfortunately, Alberta is at the lowest uptake in this age group. So in the under 11 age group, 11 and under age group, we are at the lowest uptake in Canada. And we can probably replicate this kind of curve, however, nationally. So we saw a bit of a bump initially, but then there has been a bigger increase in this uptake since the Omicron wave. And I am hopeful, and this is why I'm here with you today, I'm hopeful that we can do even better to protect our children. And I have to give a shout out to provinces like Newfoundland and Labrador. There are over 75% uptake in the childhood vaccines for COVID-19 in the 11 and under age group. And they're doing a fantastic job for protecting their kids. In the US, and we're lucky that we can look at other places like the US in terms of just sheer numbers of children vaccinated. So even though they only have about 25% of their kids fully vaccinated in this age group, in the 11 and under, we're talking millions of doses. And as you see here, we're talking over 10 million doses of this vaccine having been given to children without a significant safety concern or a significant safety signal so far. So again, we're lucky that we can look to the US and be reassured and strengthened in our resolve to protect our kids with this vaccine. So we knew this before the pandemic, and it's been there through the pandemic as well. And initially, this data was for adults and vaccine hesitancy. But this kind of demographic representation also holds true for some of our parents, obviously with some exceptions. But typically, the vaccine hesitant tend to be racialized or historically marginalized, dependent on less reliable source of information. They are parents, have a household income under 40,000 a year, and they tend to be younger. And the exact specifics are not the same in every jurisdiction, in every place, but the overall trends are there, and they're very similar. We know in Canada, before the COVID-19 vaccine became available, when this is work done by Angus Reid just before the vaccine was available to kids. So this was in October. And when they asked parents if they would take a vaccine as soon as it was available to them, just over 50% of parents said yes. Now we know that vaccination intent does not always translate into actual vaccination uptake, but over 50% of parents said they want to take a vaccine as soon as it was available to them. This is when we were worried about myocarditis as a safety concern because we had seen it in teenagers. And of course, now with millions of doses in the US, we know that's not the concern that we thought it might be. And this is before the Omicron wave had come and infected so many of our kids. And again, you see here a distribution, a difference in Alberta being the lowest in terms of intent to uptake. And what's really impressive is that when you look at the Atlantic provinces, they've done better than the initial uptake, the initial intent. And then here again, you're seeing it. We see that people who have lower formal education and lower household income tend to be more hesitant around the vaccine for their kids. We then took this a bit step further in the 19 to 0 team, and we actually asked of the people who said they would not be willing to vaccinate their children, we asked why. And these are the top reasons. And what I think is interesting is we probably could have predicted, and I would say these are still some of the top reasons. Top is that they feel that children are not at high risk of disease or severe consequences from the disease. Safety is always big. And in terms of safety, myocarditis, fertility, and other reasons, as in mostly long-term concerns about the vaccine, come up. And then this idea that if you're a survivor and you've had immunity, we know that now there is protection. And then they felt, and this is every parent's dream. And I say that because I've dreamt it. I have 3 children. This used to be my dream, where I would just imagine that my children had COVID. We didn't even know about it, and now they have immunity. And this actual kind of hopeful thinking is quite prevalent among parents, and I don't blame them, because this is the best case scenario: is your child has had it, they have immunity, but they haven't felt any of the severity of the disease. We know, of course, from numbers and data that before the Omicron wave, less than 10% of children had actually had immunity to COVID, to SARS-CoV-2. Overall, here's where it kind of breaks down for the vaccine hesitant parents. They're more concerned about vaccine safety. So often they'll come and they may have what may sound like a philosophical debate, a conspiracy theory type of approach. But at the bottom, when you dig in terms of what really worries them, it's safety. They want to make sure the child is safe, and they're worried that something is going to happen if they have the vaccine. Really prevalent in terms of COVID-19 is that they feel the children are at high risk of complications. Again, this idea that the child might have had COVID in the past. And lack of trust comes up again and again at various levels. So pharmaceuticals, governments, health agencies. And what was also interesting for us, and when we asked this question about vaccine hesitant clinic patients, they also reported that they felt they had had a negative interaction with healthcare providers in the past. And this was not necessarily from healthcare providers, not necessarily around the vaccine, or they have had a negative interaction with the vaccine in the past, or had some kind of history about a negative interaction with the vaccine in the past. And sorry, I just saw somebody say, somebody was asking about data from 2021 or 2022. I think this in the chat, I can't help myself. I'm like a squirrel. I just have to look at everything on my screen. The data I showed you in children is in the last 4 weeks here in 2022. So last week of December and the first 3 weeks of January. Okay, sorry, this had nothing to nothing to do with what I was talking to you about. All right, in terms of where this idea of the 3 big C's of vaccine hesitancy that were put out by the WHO they come up over and over. And I kind of tongue-in-cheek said nothing new. There's nothing new under the sun around COVID, around vaccine uptake and hesitancy. And in some ways, I actually think it's true. The same principles apply, and the same tools apply. And I imagine that Arnaud's approach of motivational interviewing is going to work just as well for COVID-19 vaccine uptake as it would for the other childhood vaccines. So confidence, complacency, and convenience are the 3 big categories whereby you can put parents' concerns into. And depending on where we are in the pandemic, you can see a different concerns at different times, and these 3 C's take over a different importance depending on where we are in our waves. The other 2 C's that I haven't mentioned are a collective responsibility, and I'll talk a little bit about that, and then also this idea of calculation. Where do you get your information from? And I would say that has been a really crucial component that's affected all these other components of vaccine hesitancy, is this information and misinformation and disinformation. But confidence is always often about safety, efficacy. Does it work? Is it safe? And do I trust who's going to give it to me? Complacency, really important in childhood vaccines and really important in between the waves. So we see a drop in vaccination uptake as people no longer see this disease as a threat. And Omicron being branded as mild very early on in the pandemic did some damage to that as well. Very early on in this wave did some damage to that as well. What we've also noted among our vaccine hesitant patients is this double their exceptionalism in two ways. So one is they're exceptional in that they're unlikely to get the disease, or if their children got the disease, they're unlikely to have bad outcomes. But also so exceptional that if they are going to have the vaccine, they're going to get some very rare side effect. So this is what we're fighting: is this sense um, of too exceptional to actually get bad disease, but also too exceptional to just have a simple outcome, the most common outcome of the vaccine, which is no side effect or very mild side effect. The issue of convenience, or what I would like to say mostly about access, is really, really crucial. And there's been a big difference in how we've approached access for adult vaccines, where we had vaccination buses, where you could get the vaccine in pharmacies, you could get the vaccine pretty much everywhere that adults were, or especially after initially we saw there were issues with access in areas of high vulnerable frontline worker need areas. But with children, it's been very different. With children, we have made it much more difficult for parents to access the vaccine. We don't have the same widespread accessibility. We also mostly have not, for example, in Alberta, we've hardly had it in pharmacies at all. There are only a couple pharmacies that actually have access to the vaccine for children, despite supposedly enough supply of vaccine. So this is important. It's going to play a role in our uptake. I really like this slide because it also gives you, it's the nutshell approach for vaccine hesitance and hesitancy and confidence around the COVID-19 vaccine. So this is a slide there's a study that actually looked at low-income countries and middle and high-income countries. And confidence is based on two main principles. One is people approach it from a personal protection perspective rather than a collective responsibility. So even though many of us want to call on the world and this pandemic to say this a chance to show collective responsibility, over and over again, multiple surveys have shown that when you ask patients and parents why they want to have the vaccine, it's for personal protection. So important that when we message this vaccine, children, we vaccinate children so we can protect children. Healthcare workers were, before the pandemic, and still are, the most trusted source of vaccine information. So what a privileged position for us as healthcare providers to be in, that despite all the changing recommendations, despite the misinformation out there, healthcare providers are still trusted by patients and by parents to provide the accurate information. And misinformation has played a big role. And there are two main issues that I've now mentioned over and over: safety and side effects, and complacency, and this altered risk calculation, this exceptionalism kind of approach to the disease and to the vaccine. So we know concerns are in hesitancy are natural. Hesitancy doesn't stem from ignorance. And I really love the quote that says, facts, people don't disregard facts because facts are untrue. They don't believe facts because they don't apply to them. So how do we make science and facts applicable to people? So this is that behavioral link that we need to do between just good old facts and information into how do we translate that into changing people's motivation. And I also want to say that right now, at this time of the pandemic, it's really important to acknowledge that a lot of people who've been advocating for health and for vaccine might have reached fatigue. There is guilt. I've heard family physicians talk to me about how they had an opportunity to talk to a parent, also to a patient about the vaccine. They did, and then the patient did not get vaccinated, and then they end up having COVID, having a severe COVID, and actually died. And they are grappling with the guilt of saying, I've had the chance to potentially change this, and it hasn't worked out for the way I was hoping to work out. So how do you deal with that confusion and fear? So I will share with you kind of my approach and some of the work that we've done and what we have learned from a behavioral perspective in terms of approaching issues around vaccine uptake and hesitancy. So we've done some work on the COM-B model, which is this idea that the behavior is really about the interaction of your capability to do the behavior, your opportunity to do the behavior, and your motivation to do the behavior. And when we typically talk about capability, when we asked our vaccine hesitant parents what issues around capabilities came up, so access was really important. So, and then pain mitigation, which you've heard a lot about, and also a lot of historical trauma and lack of trust overall, and perceived contraindications. So feeling that, for example, my child is allergic to penicillin, therefore I'm worried about the vaccine. So a perceived contraindication about their own personal history. And opportunities here are, number one, we have to improve access. We have to make this vaccine for children available where the children are. And we could debate about vaccination in schools, but when vaccines are offered in schools, the vaccine uptake goes up. We also, hockey arenas, if children are open to activities, which right now in Alberta, for example, we don't have any restrictions, then we should be there with the vaccine where the children are. And we need to streamline this process as well. And when we don't have good access, it becomes an equity issue. Inevitably, those children who are most vulnerable are going to be most affected when access is a problem. Pain control measures that I know you've heard a lot about. And then what was interesting from a trust perspective, when we asked, well, okay, we get it, you don't trust government, you may not trust policy, but what would change your mind about it? The answer was if parents felt that healthcare workers who are on the front line, so frontline healthcare workers were actually engaged in public health policy, because they saw a disconnect between the people who made the policy and the people who are on the ground. And they wanted to see a partnership there in terms of making the policy. So we thought that was interesting to hear that, and potentially not impossible to change. When it comes to opportunity to take the vaccine, pandemic and vaccination fatigue, especially around boosters, is definitely kicking in and has been shown to be a problem for people. Previous negative experiences with vaccine, but also with healthcare providers. There were a lot of brand concerns that I know you're all familiar with, between Pfizer and Moderna, AstraZeneca, and then feeling erroneously safe in isolation. We call this the bubble dwellers, the people who felt that well, if I just protect my child and isolate them, they're going to be safe from this disease. And I think Omicron has definitely burst that bubble. So the opportunities there are focusing on, so peer pressure to vaccinate is important. And I'm not saying this is a way of coercion, or in no way does it mean that at our one-on-one interactions, we should still not be about partnership and support and all those principles that are now shared with you. But the peer pressure among parents is important, and we have to recognize that. And this is why we need to have vaccine champions. So early on in the pandemic, we saw celebrities and political figures being filmed while they were getting their vaccine, and it would be wonderful to see their children getting the vaccine as well, and that being really well uh, well established that there is that peer pressure there for it. Focusing on long-term effects of the pandemic is important. I think parents are starting to realize that even children who have not had COVID, their lives are changed, and our children's lives are not going to be the same with all the socialization loss, the education, the learning loss our kids have had to go through, the mental health crises that our young people have suffered. This is going to affect them long term, and focus on positive interactions. So I say this often to my emergency colleagues because they'll say, well, I only have a few minutes and I figured out that this parent has not vaccinated their child, and what can we do? You may not be able to address the vaccine issue, and you may just be able to refer them to somebody who can do it, but you focus on having that positive interaction with that parent in that instant, because we know that that can shape vaccination behavior or vaccination intent. Um, and motivation is really important. So this is wanting to do the behavior. So we know that this has been motivation has been very much a victim of misinformation, media and social media distortion, and this perceived low risk of disease and the perception of the pandemic is less than it is. Early on when this Omicron wave started, people would not believe that kids were in hospitals. They would get calls that said, you guys are making this up. Children are not actually admitted to hospitals. And it's just mind-boggling of how entrenched this hopeful thinking can be, that people do not see the pandemic for what it is. So the opportunities there are encouraging individual agency. So again, you're not helpless. You can do something to protect your child, and you're doing this vaccine to protect your child. So that kind of messaging is important for parents. Increasing concern with COVID as a disease. It's interesting that in many guidelines and often when people talk, the first thing they say is most children do fine, have mild disease. And that's not wrong because it's true. But that's where parents stop. That's what they believe. They forget the next part, which says, but not all children do well with the disease. And 1 in 3 children in the US hospitals with the Delta wave were actually previously healthy children. So significant number of kids who ended up in hospital. And then vaccination has to be set up as the norm. And we're slowly, unfortunately slowly, but we're getting there. So even something like the NACI recommendation, which until yesterday or the day before, it was may consider immunizing your child, has now been changed to a strong recommendation of should immunize your child. But when we address this at a public level, vaccination should be set up as the norm. That's the norm because that is the way we would protect our child, not taking away choice or agreement from the parent, but establishing that as the norm in how we talk about this vaccine at the public level. And mandates will inevitably increase uptake. Now, we could go into the debate of mandatory vaccination for children, but in adults, without a doubt, the small percentage left that has not had a vaccine, behavioral nudges such as mandates have been shown to make a difference. Incentives have not. So let me just, I only have a couple of slides left, so I will be done in my allotted time. But there's this sense of urgency. So when we talk about public level messaging to parents, the 3 things are sense of urgency to combat complacency. This is the biggest threat in terms of vaccine preventable diseases our children are facing right now is COVID. And that might change, and we are all hoping it will change. But we are seeing that in places where they haven't had the same level of public health restrictions, they've had way more children's death and severe outcome. And we're all hoping that these restrictions and the public health measures are not going to be here to stay for a long time. Highlighting other groups who've been successfully vaccinated and safely so is also one of the highlights of what people can, the public level messaging. And again, setting vaccination as the norm, not as an option. Not as a you may, if you choose to, you should vaccinate your child is important. And this is at the public health level, not at the one-on-one level. It's still important to explore, to show that creativity, to still to show that curiosity and to support the parent. But we need to set it up as a norm. Messages on one-on-one. Important to remember the past history, so cultural trauma and how that impacts the vaccination decision. And we're seeing this with some people who have had really difficult vaccination experiences themselves as children. Negative or positive interactions with the healthcare system or perceived personal contraindication to immunization, often erroneously so. But important to explore those things that might be there. Focus messaging on personal health benefit of the vaccine, not collective responsibility, is because we have to meet people where they're at, not where we would like them to be. Children's mental health and socialization being so important. Outline how we as healthcare providers have vaccinated our own children. I have 3 kids, 10, 7, and 4, and both my 7 and 10-year-olds have now had their 2 shots of the COVID-19 vaccine. And aim for a positive interaction, because that's how you start building that trust with the parent. The messenger is really important, often more important than the message. Remember that as healthcare providers, we're in this really privileged position of having parents trust us. So here are my four if you are going to become a vaccine champion and you're going for a walk with your friend, here are the 4 things to remember when you talking about the vaccine. You have to connect before you can communicate. Show true curiosity. You have to meet them where they're at. Validate the emotion. So not necessarily the belief, but the emotion. And it's often a fear that's behind the decision to not vaccinate, and keep it very personal. No philosophical debates. This is about helping them make a decision about their child. Thank you.